Musculature is what we're looking at in this video. Starting here superiorly, we've got Frontalis muscle, Orbicularis oculi, Orbicularis oris. We've got Zygomaticus minor and Zygomaticus major. Coming down from zygomatic arch onto the mandible is the masseter. So this and that. On the lateral side of the head, temporalis muscle. And then coming down into the neck, we're going to see sternocleidomastoid. Here's towards its insertion. And down here we can see the clavicular origin and the sternal origin, both of sternocleidomastoid. So that would have gone back up to that muscle. Here we see omohyoid. This is going to be the superior belly of omohyoid, and this the inferior belly of omohyoid. This is sternohyoid muscle, so all the way from the sternum to the hyoid, whereas where that muscle has been removed on his left side, we can see what's deep to it, where we get a sternothyroid, which goes from the manubrium just to this thyroid cartilage. And then the rest of that distance is the thyrohyoid muscle. So thyroid cartilage to hyoid bone. So right in here, we're going to see the anterior scalene, middle scalene, posterior scalene, and then this big strip is levator scapula, or levator scapulae if we're talking about both sides. Getting down into the chest, we see pectoralis major. And where pectoralis major has been removed, here's pectoralis minor on its way back to its insertion. Rectus abdominis. Over here we can see serratus anterior. Go into ribs 1 all the way to 8. Here are some internal abdominal obliques because the external has been removed. On this side, we see external abdominal obliques. Down into the thigh, we've got sartorius. This bipennate muscle here, rectus femoris, vastus medialis, vastus lateralis. We can see pectineus. On the opposite side of the femoral artery, we're going to see a little bit of iliopsoas. From this white piece, heading inferiorly is the adductor longus muscle. And then what we see over here, more medial, should be the gracilis muscle. Down into the leg, we've got tibialis anterior, extensor hallucis longus, which just becomes this tendon. This is still extensor hallucis longus. Extensor digitorum longus muscle right here, which becomes these 4 tendons. And then over here, fibularis tertius muscle, also called peroneus tertius muscle. All of that comes to this tendon, which instead of going to a digit, goes to the 5th metatarsal. You can also see fibularis longus muscle and fibularis longus tendon and fibularis brevis muscle, which is deep to that tendon for fibularis longus. In the foot, we've got extensor hallucis brevis, just this one muscle belly and one tendon, and then extensor digitorum brevis, these 3 muscle bellies and what ends up to be 4 tendons. Also, abductor digiti minimi and abductor hallucis. We've got posterior view. Here we've got occipitalis, which is the posterior part of the epicranius muscle. And frontalis plus occipitalis make up epicranius. Over here we see trapezius, which is going to come all the way down to spinous process here. And then it would be a trapezoid shape, so it would go on both sides, but the triangle for the left half has been removed so we can see what's deep to it. Deep to trapezius, we're going to see splenius capitis, right here, all of that. We can also see some of the levator scapula, or if we were talking about both sides, levator scapulae for plural, here and there. From spinous process to the medial border of the scapula, rhomboid minor, and then just inferior to that, rhomboid major. Right, they're both shaped like a rhombus. Here we can see the erector spinae group. So close to the spinous processes is the spinalis muscle. Long, going all the way from about the ilium on up into the cervical region, is the longissimus muscle. And then further over, we're not seeing any of its insertions right here, but going from the ilium and inserting onto a bunch of different ribs is iliocostalis. That would be the most lateral of the erector spinae group. This is probably not in your lab guide, but this is serratus posterior inferior muscle. And then here we can see a little bit of latissimus dorsi, and it's been cut, bisected there. On this side, we see a lot of latissimus dorsi. It's all present. So here we see teres major, and just superior to it, teres minor. Under this fascia is going to be infraspinatus muscle. You can see those a little better over here. So infraspinatus, all of this, teres minor, and then teres major. Above the spine of the scapula is supraspinatus. And then coming off this way is the deltoid muscle. All right, let's head inferiorly. So on either side here we see Gluteus Maximus. And here Gluteus Medius. So we can remove Gluteus Maximus to see more of Gluteus Medius. Then here, this bigger one is Piriformis. This is Quadratus femoris. Obturator internus. And then on either side of obturator internus are the gemelli. So superior gemellus and inferior gemellus. Alright, looking at posterior thigh, we can see biceps femoris right here. Got long head of biceps femoris and then short head of biceps femoris. Can also see semitendinosus, and on either side of that, semimembranosus. Here, semitendinosus, semimembranosus, biceps femoris. From the posterior view, we can see adductor magnus there, and gracilis. Going into the leg, we can see gastrocnemius, here, soleus, deep to that, both of those inserting onto the calcaneal tendon. And then deep to soleus, we're going to see flexor hallucis longus, tibialis posterior, and flexor digitorum longus. So flexor digitorum is the most medial, flexor hallucis longus the most lateral, and the hallucis tendon has to cross over to get to the hallux. Alright, so we're looking at Tuff Ted's arm, or upper limb now. So we can see deltoid muscle right here. Biceps brachii muscle with the long head and the short head. Deep to biceps brachii is going to be Radialis muscle. And then coracobrachialis right here. On the anterior compartment of forearm, so we can see brachioradialis. Go. Posterior forearm, we see brachioradialis, this big muscle, followed by extensor carpi radialis longus, extensor carpi radialis brevis, abductor pollicis longus, and extensor pollicis brevis. And then our extensor pollicis longus muscle is going to come up here, and the tendon for it is this guy. Come across. Back here we see extensor digitorum. Just a little bit medial to that is extensor digiti minimi, which is going to be this tendon. Back here, this little triangle on the lateral side is the Anconius muscle. And then we get into muscles of the hand. So we can see dorsal interossi. The interossi go between metacarpals. So this would be between digits 1 and 2, 2 and 3, 3 and 4, 4 and 5. And then here, on the ulnar side of the hand, we're going to see the abductor digiti minimi. This side of the hand, we can see abductor pollicis brevis, flexor pollicis brevis, adductor pollicis, and lumbrical muscles in between these tendons right here. These are lumbricals. Then over here we'll see flexor carpi radialis, Palmaris longus, which is the tendon that comes all the way to the palm of the hand, flexor carpi ulnaris with this tendon. The muscle on either side of Palmaris longus tendon is going to be flexor digitorum superficialis muscle. And then finally this muscle belly that you see up here, this is pronator teres. Posterior arm. The only muscle back there is the Triceps Brachii. So we're going to have the lateral head of Triceps Brachii, long head of Triceps Brachii, and then under here would be medial head. So looking at the other arm, which is more in the position we're probably used to, lateral head, long head, and medial head.